Hello everyone, this is Bethlehem Abeba. I'm going to be talking about infant mortality in Louisiana from the public health nurse's perspective. In 2016, Louisiana was ranked second worst state for preterm birth rates with a rate of 12.3%. This is 1.2 times higher than that of the United States. Premature birth is a huge contributor to infant mortality rates. According to the CDC, 36% of infant deaths nationwide in 2016 were due to complications related to premature birth. Factors contributing to infant mortality and premature birth rates in Louisiana are that, for instance, in 2016, 31.9% of women aged 18 to 44 were obese. 21.3% of working-age women had income below the poverty line. 28% of women of childbearing age do not have health insurance. In 2014, it was noted that 20.9% of women did not access prenatal care in their first trimester of pregnancy. 23.5% of women are cigarette smokers, and 11.6% reported that they smoked during pregnancy. Additionally, in 2013, 57% of pregnancies were reported as unintended. Due to high maternal poverty rates, lack of adequate access to health care services, lack of early prenatal care, high rates of obesity among women of childbearing age, high rates of smoking in women of childbearing age, and high numbers of elective early deliveries, Louisiana has the second highest premature birth rate in the United States. The social ecological model has established that the health of an individual is influenced at the interpersonal, organizational, community, and public health and public policy levels. The public health nurse will need to address factors that help and hinder maternal and child health at every level of the social ecological model. At the individual level, smoking during pregnancy has been identified as a prevalent problem among Louisiana mothers. The public health nurse can educate mothers about the importance of smoking cessation, the effect of smoking during pregnancy, and make sure that they are aware of available smoking cessation services. At the interpersonal level, the public health nurse can assess people's knowledge and attitude towards reproductive health and address the barriers to contraceptive use. For instance, it has been identified that one of the barriers to contraceptive use is partner refusal to use contraceptive methods. The public health nurse can educate partners about the importance of spacing birth in order to improve health outcomes for mothers and babies. At the organizational level, the public health nurse can assess the community's knowledge as it pertains to the availability of medical care for pregnant women, and then work with organizations such as Medicaid to ensure that mothers of childbearing age and pregnant women know that their health care is covered by Medicaid, as long as they qualify. At the community level, Louisiana's interpregnancy care program caseworkers have found that lack of adequate and affordable housing is one of the many problems faced by low-income mothers in Louisiana. The public health nurse can assess the community's housing needs and work with governmental and non-governmental organizations to bring awareness and solutions to the problem. Lack of adequate housing adversely affects health outcomes for both mother and baby. At the policy level, the public health nurse can work to advocate for continued interpregnancy health care funding, so that programs such as the Medicaid 1115 waiver can continue to provide much-needed healthcare services for mothers of childbearing age. Interventions. The public health nurse can advocate to increase availability of inter-pregnancy care programs to serve Louisiana's uninsured women of childbearing age. These inter-pregnancy care programs will provide comprehensive well-woman care, reproductive health care, chronic disease management, and nurse case management services. Louisiana also needs to increase the number of women accessing prenatal care services in the first trimester. The public health nurse will work with the Louisiana Health Department to start mobile prenatal care screening services targeting uninsured women of childbearing age. She will also facilitate group prenatal care services such as centering to increase compliance with prenatal care. She will ensure that low-income, uninsured women of childbearing age are informed about the available health insurance services through Medicaid. To reduce tobacco use during pregnancy, the public health nurse can target OBGYN practices that care for high-risk mothers in Louisiana and work to ensure that the American Congress of Obstetricians and Gynecologists' recommendations and interventions for smoking cessation are implemented. The public health nurse, in collaboration with behavioral health professionals, can organize workshops for OBGYNs so that they can become more comfortable with providing smoking cessation counseling and motivational interviewing for pregnant women. Some barriers that the public health nurse may encounter are limited resources, lack of funding from Medicaid, lack of funding for inter-pregnancy care, for field nurses, outreach workers, mobile clinics, behavioral health professionals, and so on. There could also be lack of buy-in from stakeholders and non-compliance by the target population. To evaluate whether the interventions are contributing towards good outcomes, the public health nurse may ask the following question. Is there an increase in access to comprehensive healthcare services? Are chronic diseases being identified and addressed? Are women of childbearing age spacing their pregnancies? Are they receiving adequate care for their chronic diseases? Is there an increase in the number of women accessing prenatal care in the first trimester? Is there a reduction in the number of women who are smoking during pregnancy? And of course, the biggest question is there an improvement in maternal mortality, preterm birth, and infant mortality? The goal of this project is to reduce preterm birth rates in Louisiana. Inter-pregnancy care, early prenatal care, and smoking cessation are all interventions that will help the state achieve the goal of reducing adverse birth outcomes. The success or failure of each intervention will determine whether there will be an improvement in outcomes. So some of the outcomes that we are looking for are reduced number of unplanned pregnancies, increased number of women with controlled chronic diseases, reduced number of women with repeat adverse birth outcomes, and if we want to get more specific, by 2020, 95% of pregnant women in Louisiana will have access to prenatal care in their first trimester of pregnancy. And we will see a reduction in the percentage of women who smoke during pregnancy, see a reduction in the number of low birth weight infants, reduction in the number of smoking-related pregnancy complications. And all this will come together to have an impact in reducing the number of preterm births in Louisiana. Thank you.